Hey everybody, Dr. Womack here, and welcome to Breathing 101. I wanted to give everybody a real quick snapshot about how we breathe and why we do some of the things we do in terms of using oxygen, CPAP, and BiPAP to take care of our patients here at the Center and Waterfront. So let's talk first just about simple breathing. Breathing 101, oxygen in, carbon dioxide out. Inhale, exhale, right? We all do it 100,000 times a day. But what's really going on? Well, in my brain, I have to use analogies to think of things. So I want you to think about a train, all right? Keep in mind I went to medical school, not art school. So this train is what carries oxygen into your lungs and has to bring carbon dioxide back out. And I'm going to come back to this analogy a whole bunch of times to help you understand what we do when we breathe. Now keep in mind that the air that we breathe every day is not made up of pure oxygen. It's only about 21% oxygen. The rest of it is nitrogen, carbon dioxide, other gases that don't do us any good. So when you breathe, you take all this air in, but your lungs only use about 20% of it, and then you breathe it all back out again. So what happens when you need more oxygen than just the 21%? What you need to increase someone's oxygen who's having increased oxygen needs, what do? You increase the amount of oxygen they're breathing in, right? You put them on extra oxygen. So instead of your train car bringing in 20% oxygen, now it's bringing in 50% oxygen or maybe 70% oxygen. More oxygen with each trip means more oxygen is going to be provided to their lungs, whether it's not having to work as hard to breathe. That's the basis of providing extra oxygen to people. This is what happens when someone has pneumonia or pulmonary edema. They've got part of their lung that's filled either with pus or with fluid, or maybe someone who's had surgery and part of their lung is missing. They have less lung tissue available to them. So the only way they can get the amount of oxygen they need to their body is to increase the oxygen that's coming in because they have less lung that's doing the job. So when we have to provide oxygen to somebody, we have multiple ways in which we do it. And the first one you'll see us use all the time is a nasal cannula. Nasal cannula is that little thing that goes under your nose with the prongs that shoot up into your brain, and you get somebody oxygen. And hopefully you see us go 0 to about 6 liters. The reason for that is over 6 liters, it kind of starts to become very painful to the patient, and you start to lose effectiveness. It's not going to be any better at 7, 8, 10 liters. 6 liters with a simple nasal cannula is about as most as you can do. Now they do make some high flow nasal cannulas. These are a different looking device that you may see. One of them has a medallion about like this that serves as a reservoir for extra oxygen. There's another one called a nasal mustache that actually has a fairly thick piece that goes across underneath the nose that also acts as a reservoir for oxygen. With these high flow nasal cannula devices, you can go up to about 8 to 10 liters sometimes and provide more oxygen with a nasal device. But with a traditional nasal cannula, you stop at 6. Then you go to a simple mask and then maybe to a non-rebreather. An important note is that if you're going to put someone on a mask, you have to start at about 6 liters. Nobody should ever be on a mask at under 6 liters. Because if you're at too low of oxygen and you put someone with a mask on their face, they're going to start rebreathing their own bad air. Remember our train, when you take oxygen in, you also bring carbon dioxide back out. So they breathe that bad air back out. But if you put a mask over their face, they're going to be rebreathing that bad air back in, unless it's a high enough volume of air coming in to help blow out the carbon dioxide. So 6 liters up for a nasal cannula. Above 6 liters, go to a mask and keep it at above 6 liters. At the other end, we use 2 devices called CPAP and BiPAP. And that's what the next 2 videos are going to cover in detail, is to how we use those devices and why we use them. See you later.